Um, Good evening, everyone. I would like to begin by thanking Intas to give me this opportunity to talk about novel formulations of Taxanes. So, outline, how do we go with this presentation? Challenges with conventional Taxanes. Nano Aqualip technology, is it a solution? Nano Aqualip formulations in breast cancer and data beyond breast cancer. So polysorbate 80 hypersensitivity reaction is commonly known to us, and we all have faced the reactions in Taxanes. In past decade, reports of hypersensitivity reaction to docetaxel have been increasing steadily. Nearly 30% of patients who do not receive pre-medication have any form of reaction with docetaxel. And even with pre-medication, there are reports of 8 to 13% of hypersensitivity reaction with docetaxel. Also, using pre-medication steroids have increased risk of hyperglycemia. Around 13.7% patients had some form of increase in sugars with steroids. This study concludes that adverse effect associated with prophylactic steroid use should be better recognized. Optimal management of steroid-induced hyperglycemia is recommended to reduce infections with docetaxel therapy. So, because of this adverse events, docetaxel-associated candidiasis as an adverse event has been reported and prescribing information leaflet. So, this Nano Aqualip technology, this is a lipid-based platform technology for difficult to formulate poor water-soluble drugs. Advantages: complete aqueous-based system, free of hazardous organic solvents. Particles are nano-size. All excipients used are naturally occurring lipids. So what is the difference between conventional and nano Aqualip formulation? Organic solvents like polysorbate 80, trimethoprim used for stabilization in conventional Taxane formulation. While in nano Aqualip formulation, it is completely aqueous-based solution. Leaching of plasticizers from PVC bags and IV sets. So we have to use non-DHEP containing. So it was there in conventional Taxanes and it is not there in nano Aqualip formulations. Hypersensitivity reactions was there. As we discussed, it is high in conventional Taxane formulation, while grade 3, 4 hypersensitivity reactions are not a major concern in nano Aqualip formulations. Steroids need not to be used, so adverse effects of steroids are not there. Safety concerns and neurotoxicities are less in nano Aqualip formulations. Leaky vasculatures, because the nanoparticles, 100 nanometers, nano Aqualips penetrate in the tumor tissue better, with higher C concentration at tissue level. So with the TR ratio being 114%, higher systemic bioavailability of this nano docetaxel in plasma compartment. This is an open label randomized multiple dose clinical study of nanosomal docetaxel lipid suspension in patients of breast cancer, locally advanced or metastatic breast cancer who had prior failure to chemotherapy, where docetaxel was compared with nanosomal docetaxel at a similar dosage of 75 milligram per meter square given every 21 days. The primary endpoint was objective response rates, and no steroid pre-medications were given in a nanosomal form of docetaxel. We can see the overall response rates of CR and PR was slightly higher with nanosomal docetaxel from 26% to 35%, with higher CRs and higher PRs. And adverse events with nanosomal docetaxel forms were less. So adverse event, severe allergic reaction like bronchospasm or swelling of face were not observed with nanosomal docetaxel, whereas with conventional docetaxel, 2 cases of bronchospasm and 3 cases of swelling of face were observed. No clinically significant changes were observed in hematology and biochemistry of nanosomal docetaxel compared to conventional one, and neutropenia was consistent with those reported with conventional. The other study in breast cancer, neoadjuvant setting in patients with stage 2B and 3 breast cancers or neoadjuvant chemotherapy. After AC, the patients were divided in 2 arms, whether to receive conventional or nanosomal docetaxel at a dose of 75 milligram per meter square every 3 weekly for 4 cycles. It was presented in ASCO 2022. So the patients were equal in both the arms, the 30 patients in both the arms. with similar profile of patients. And this says the patient had similar outcomes. So this data was very, very small, only 30 patients. They're saying 100% PET-CR, but the data is very small. So it is similar in both the arms. So the highlight of this thing is the infusion reactions, hyperglycemia, neuropathy were noted only in 5, 8, and 3 patients in the conventional arms, while it was not reported in any patient of nanosomal docetaxel arm. So nanosomal docetaxel-based neo and adjuvant therapy is as efficacious as conventional one, and it has less side effect. Similar response rates. This is the data which is showing that. So going beyond breast cancer, so nanosomal docetaxel in non-small cell lung cancer, patients treated after with platinum therapy. In second line, the data with 75 versus 100 milligram per meter square, almost 80 patients were randomized. So the response rates for all, this is the patient's data with similar profile in both the arms. The overall response rates and disease control rates are similar in both the arms, 75% versus 100 milligram per meter square. And safety-wise, 75 milligram per meter square was safer with similar PFS and OS. So this is another study of nanosomal docetaxel in metastatic CRPCs. So 24 patient data was analyzed. Patients, 9 out of 24 patients received 2 weekly, while other patients received 3 weekly regimen. With a good PSA decline in more than 90% in around 55% patients in 2 weekly arm and 40% in 3 weekly arm. The only thing to highlight here is the adverse events. The adverse events were significantly low in patients who received 2 weekly as well as 3 weekly in patients who are receiving nanosomal docetaxel form. So nanosomal docetaxel in 2 weekly and 3 weekly regimen was as effective, well tolerated in managing patients with metastatic CRPC. So concluding, serious adverse events like hypersensitivity reactions are common with docetaxel and paclitaxel, and to avoid them, we need to use corticosteroids as pre-medication. Steroids can worsen hyperglycemia, increase risk of infection. Nanosomal docetaxel is free from solvents and can be administered without steroid pre-medication. No grade 3-4 hypersensitivity reaction were observed despite no steroid pre-medication. Thank you.